In the interest of community service, Power 88 presents live talk shows to inform, enlighten, and to stimulate thought and dialogue. The views expressed on this program are not necessarily those of the staff and management of KCEP or the EOB. Now sit back, relax, and enjoy the program. Or call in and participate at 647-3688. Funding for community partners for better health on KCEP Power 88 is underwritten by the Southern Nevada Health District. And here is your host.
Good morning, Las Vegas, and welcome to A Healthier Tomorrow. I'm your host, Will Rucker, and I am so excited for today's program. As I always remind you, tell everyone you know that A Healthier Tomorrow is on the air. Today we've got some amazing guests with some news you can use, some information that is definitely going to elevate your life. And I want to start off by just reminding you, you know, sometimes you got to stop and breathe. Sometimes you got to take a moment to just be present. And so wherever you are right now, just take a moment to recognize your breath and to feel it coming in and your body expanding and the release of it, because it's the breath that connects us all. And with that thought in mind, I'd like to introduce our first guest coming to us from the Southern Nevada Health District, a amazing community advocate, someone that's doing exceptional work, Nelly Pelaez. Good morning, Nelly.
Good morning, Will. Thank you for that breathing exercise this morning.
Absolutely. So I'm glad to have you on today because we want to talk about a very serious issue, which is secondhand smoke and smoke-free housing. Before we dive into that topic, would you tell folks a little bit about yourself?
Yes, of course. Thank you so much for having me on the show. So as you mentioned, I am a health educator at the Southern Nevada Health District. I've been working there for about 5 years as a health educator. We, at the health district, I particularly work in the Office of Chronic Disease Prevention and Health Promotion, in the Tobacco Control and Prevention Program. And one of the missions of the Tobacco Control and Prevention Program is to reduce secondhand smoke exposure among our community. So, that's one of the initiatives that I particularly work in, and I'm just, I think there's a lot of work to get done here. I'm very excited to be part of this initiative and talk about it this morning.
Yeah, it definitely is a lot of work to do here, especially in the Las Vegas area. So what is the issue with secondhand smoke, particularly in multi-unit housing?
So as we know, Will, secondhand smoke is not just about odor, right? It is dangerous and it can have serious harmful effects on the health of any individual. But even more impactful than that, we also have to think about the individuals with underlying chronic diseases, the elderly, and of course, kids and babies. The issue in multi-unit housing is that secondhand smoke easily drifts into apartments from neighboring units. This is a common problem and a challenge because of the shared ventilation between the housing units. And we have to remember it can also travel through the outlets, light fixtures, hallways, balconies, and patio areas. Just to give you a quick statistic here, more than 1 in 3 non-smokers who live in rental housing are exposed to secondhand smoke, and 2 out of every 5 children are exposed.
Wow. That's quite alarming. 2 out of 5 kids. That's 2 out of 5 too many. I don't know if I said that quite right,
yes,
but it's way too many for the exposure. So tell us a little bit about what you're doing with this. What is the Smoke-Free Housing Initiative?
So the Smoke-Free Housing Initiative actually rooted from increased awareness of the dangers of secondhand smoke, and therefore there was a public need for housing that was free from the dangers of secondhand smoke. And so alongside many partners, the health district has been working on this initiative for over 15 years now. This work to increase the number of smoke-free apartment communities in Clark County has been ongoing, and today continues to be one of the missions that the health district has to help reduce, again, that secondhand smoke exposure in our communities. So providing smoke-free apartments in our communities, we're hoping to help reduce secondhand smoke exposure by doing that.
Awesome. So for the apartment managers and owners out there listening today, what can they do about secondhand smoke issues in their buildings?
So I'm glad you asked, because I know that, we've been talking about secondhand smoke. We know it's harmful, but there is good news. And the good news is that secondhand smoke exposure, it can be prevented. There are actions that can be taken by apartment managers and owners in the state of Nevada to prevent further secondhand smoke exposure. So one of the things they can do, for example, is implement what we call a voluntary smoke-free policy in their property. For example, the Nevada law allows apartment managers and owners to develop their own smoke-free policies, and this can be, for example, policies that prohibit the use of tobacco, e-cigarettes, and marijuana. And they can even establish what we call a minimum distance from which smoking cannot occur in the property. So really, there are many options when it comes to implementing a smoke-free policy, and many things and resources available to managers who wish to move forward with this kind of initiative in their communities.
Awesome. So what resources do you at the Southern Nevada Health District provide to apartment managers and owners who want to make that move and to make their property smoke-free?
Yes. So the Southern Nevada Health District has a smoke-free housing toolkit that apartment managers and owners can use to guide them through every step of the way when thinking about implementing smoke-free policy in their community. The toolkit it just covers anything from, like, for example, what kind of language to include in the policy, and it can also include what types of different enforcement strategies and methods to use. I mean, it is really a thorough guide in every step of the way through the implementation process of the policy. And aside from the toolkit, we also provide smoke-free signage and promotional marketing materials, such as leasing banners and outside banners that property managers can use to advertise their property once they decide that this is the step they want to take and they want to become smoke-free. Once they become smoke-free, we help them advertise that property through different methods. So, and the best part about everything is that this is all free. This is all free of charge to any community that decides to go through with this process.
And that's important to note. Being free makes a big difference. And also, there are a lot of folks that want to make a difference and to make these type of changes and improvements, but just don't know how. So having that comprehensive toolkit, I think, is so important. And then you also provide direct support. So if someone needs your help, like, you're happy to walk them through it, right?
Absolutely, yes, of course. So if someone is in need of finding a smoke-free place to live and they don't know where to start, they don't know how to look, they can actually contact us, and we can help them through that by providing them a link to our directory. So if somebody is looking for a smoke-free place to live, they can themselves search through our smoke-free housing directory simply by visiting gethealthyclarkcounty.org. In our directory, we have over 300 apartment communities that are part of our directory with over 60,000 smoke-free units available. We have properties from all over Southern Nevada listed. They range anywhere from affordable living to senior to luxury. So many, many options available in our smoke-free housing directory.
Awesome. Well, thank you for sharing that. Yes. Got one more question before I let you go here, and you kind of led into it with the last answer, but are there resources for people who want to quit smoking or vaping available?
Of course. Well, yes. So if you or someone wants help to quit smoking, there is the Nevada Tobacco Quit Line. The Nevada Tobacco Quit Line is a free phone-based service available to Nevada residents at 1-800-QUIT-NOW. And, they provide free resources, free nicotine replacement therapy for qualified individuals, quit coaches that will guide you every step of the way. It's a great service that we definitely collaborate with the Nevada Tobacco Quit Line. So again, it's 1-800-QUIT-NOW, and that's the resource we would like to share with you.
And that's also completely free, right?
Absolutely, completely free.
Excellent. Well, Nelly, thank you so much for joining us on A Healthier Tomorrow today. I really appreciate all the insights that you bring. And I just want to say thank you as well for working to make our community a healthier place to live. Your work is not going unnoticed, and you are absolutely making a difference.
Thank you for having me, Will. Thank you for allowing me to share this piece of information this morning. I appreciate it.
Absolutely. The Healthier Tomorrow radio program is brought to you by the Office of Chronic Disease Prevention and Health Promotion at the Southern Nevada Health District. Secondhand smoke knows no boundaries. If you are looking for a smoke-free place to call home, we can help. We have over 60,000 smoke-free apartments in Southern Nevada listed in our smoke-free housing directory. To search our directory, visit gethealthyclarkcounty.org and click on the smoke-free housing icon. With that, I'd like to introduce our next guest. We've actually got two amazing individuals here in the studio. Getting to know them this morning. They are delightful and so full of insight and wisdom. And they're going to talk with us a little bit about breastfeeding, because August is National Breastfeeding Month. So they're going to share things like the benefits for the child and the parent. They're going to tell us a little bit about their background. So if you haven't already, tell folks A Healthier Tomorrow is on the air and ask them to tune in right now. With that, Roxy, I'm going to start with you. If you don't mind, introduce yourself and your partner here today, and we'll get into the topic.
Sure. Hi, good morning. My name is Roxy, and I am a nurse with the Nurse Family Partnership Program, and we work for the Southern Nevada Health District. And I have here with me my coworker, Jenn. She is also a nurse with the Nurse Family Partnership Program.
Awesome. Well, good morning. And Jen, tell us a little bit about yourself.
Good morning. I am a nurse home visitor with the Nurse Family Partnership Program at the Southern Nevada Health District. I've been working there for about 2 years now, and our program provides resources, education, and support to low-income first-time moms. Our goal is to help promote a healthy pregnancy, a healthy baby, and eventually get them to be economically self-sufficient.
Awesome. Well, that sounds like some great work that you both are doing. So again, before we get into the topic, I want to learn a little bit more. So you're not wearing scrubs. You don't have a stethoscope or anything. So tell me a little bit about how you got into the nursing profession and what landed you here with working with parents.
I'll go first. Okay. So before, my background is labor and delivery. That is how I started my nursing career. My passion is maternal child health, and so this transition into the health department has been a fairly easy one for me. We don't wear scrubs. We go into the homes of our patients. We sometimes do wear scrubs, though. But I find value in providing this education and support. It's a different perspective of nursing, I feel like, and we can offer, education, support, and we get a different view of patients who come into the hospital. We can, for me, I've kind of gotten a sense of why my patients didn't have the appropriate access to care. I understand better why they didn't get prenatal care during their time in the hospital. And so I think it has given me a chance to understand just the different reasons why there's limited access to health care for our population.
Wow, that's, amazing. And starting in labor and delivery, that's intense. That really, really is. And now, doing the work that you're doing, it's great. So thank you for sharing that.
Thank you.
And Roxy, I didn't forget about you over there. Tell me a little bit about your background.
Sure. Hi. So my background started as a medical assistant. I worked in several clinics as a medical assistant. I did OB, I did pediatrics, and I did internal medicine as well. And that just kind of laid the foundation for my nursing career. But I've been a nurse for approximately 12 years now. And Nurse Family Partnership Program, how Jenn was saying, is like before working in clinics or in the hospital, you get to see the patient. But in Nurse Family Partnership, you get to see like the whole dynamics for family dynamics, their home, and really what's going on. And we're able to provide them with support and, any community resources that they may need.
Awesome. So, this is the reason I do that is I want people to know that you're not just, medical professionals behind a microphone, right? You're people that have passion and experience in this area. So what you're sharing is not just beneficial health-wise. It's from the heart, and there's care and concern and love behind it. So All right, let's talk about the benefits of breastfeeding.
Okay, so there are many benefits of breastfeeding. I would say the main ones are, it's free, it's easy to access, and it provides the best nutrients for a newborn child up until however long you decide to continue breastfeeding. But I'll do the newborn.
Before you go to the newborn, you said up until however long. What's the average age?
Well, the recommendation is at least exclusively breastfeeding for at least 6 months before the introduction of solid. But if they can continue to breastfeed to a year or longer, that is even better.
Okay, good. Thank you.
But some benefits for their babies is that it decreases the risks of infections, it decreases the risk of asthma, ear infections, SIDS, diabetes, and stuff like that. Roxy, do you want to do the mom?
Sure. So not only breastfeeding benefits baby, but it benefits mom as well. It reduces risks of postpartum depression with mom. It helps mom to bond with her baby, and also it can help lower ovarian cancer later on in life as well. So there are many health benefits for mom as well, and it also can help mom to lose weight faster while she's breastfeeding too.
That's the part that I always say.
Wow, cool. So with this, sometimes it can be uncomfortable for new parents and adjusting, maybe if they have to go to work or, just family life, right? When do I find time to pump? Or can you talk a little bit about some of the best ways to ensure that they're able to continue breastfeeding once they're back at work or throughout that first year in particular?
I think education has a lot to do with it, and that's something that we provide in our program, kind of just preparing them for that, some of the challenges that they may encounter. We highly encourage skin to skin and initial breastfeeding within that first hour of life that promotes their success to breastfeed. Maybe just talking to your employers about what their options are, and really there's pumps available. There's wireless pumps now that you can do while you're working. I've worked with a lot of colleagues who, because our break times were limited, they were pumping while we're on the job, and it's very inconspicuous at that point. So there's many ways that they can try to work that out with their employers.
Yeah, I think each case is different, depending on where mom is working and, what they have available there at the workplace. And also there are laws that do help mom who do need to pump and she has a safe place to pump at work and to keep her breast milk stored.
And that's what I was going to ask about the laws, because I remember being in 2001, I was working at a huge bank, and they had a breast pump room, or just a maternity room. They didn't know what to call it at the time, but they did allow women that had just come back from maternity leave to go there. And I thought it was very innovative for that time. Because this is 2001, this is not 2023. So I know that laws have come about since then. Do you know what those laws are in particular?
Jen, do you know any in particular? Or, I know there are out there, and like I said, each family, is base by base. And if mom does have a concern and that is an issue at one of our visits, we do the research and provide them with that information follow up with them.
Okay, so they can get in touch with you all at the Southern Nevada Health District to find out if their employer is not allowing them to pump. Yes. You could possibly help them with that. That's perfect, as long as they have a resource, right?
Yes, because and especially like in the very beginning in the postpartum period, we're trying to see them weekly for the first 6 weeks. And then after that, our visits continue twice a month until the baby turns 2 years old. So we do establish that rapport with our patient, and if they are having issues after they go back to work, they address it with us, and then we provide them with the information.
That's amazing. I do have another question. I'm the host that likes to shake things up. I like to ask the questions that a lot of people are thinking but don't ask. So stigma. What is the stigma around breastfeeding in public?
I think that used to be a big deal a long time ago, but I think it's becoming more accepted to be able to breastfeed in public in this time and age, I feel.
What do you think?
I agree with Jen, but I also believe it has to do a lot with culture, family and culture. But, there are covers where you can be a little bit more modest, especially if you're out in public, because, of course, we want you to feed your baby,
Absolutely. I just wanted to bring that up because there are stigma around a lot of public health issues, and breastfeeding is definitely in public health, and we want to make sure the mothers and babies are good and they're well and healthy. But there's a lot of people who don't care about those type of things, and so we've heard throughout the news over the last, I would say, 5 years, even things that have come up with people saying things about women breastfeeding in parks and things of that nature. So I just wanted to know, how are you all seeing it since you work in this area? And if you say that the stigma is down, I'm really happy to hear that.
Yeah, I personally think it's a beautiful thing to see that occurring.
I do too.
Yeah, so.
I do too. It just reminds you that we're human.
Yes.
And we have needs, and a baby is a part of her mother, or but their mother, right?
Yes.
Whomever they may be. And just shows that family connection, I think.
And it takes a lot of dedication to breastfeed. So when I see that, I am more power to these moms, because a lot of people don't know that. I mean, we talk about how natural and how easy it is to breastfeed, but really behind the scenes, it's not. It takes a lot of work and effort on the mom's part. And so when you see someone breastfeeding in public, you know that they are successful.
They're dedicated. They are dedicated.
Yes, it is.
As a teen mom, the doctor came into the room, the nurse came into the room and said, would you like to breastfeed? First of all, I'm 15. I don't even know what's happening. Right. And I did not understand that's what cultures do. And the benefits, right? What you all are talking about now. Of course, now being older, I'm like, maybe I should have done that. But I was scared.
You needed our program.
I did need your program back then. They brought in this pump, and I'm like, what is that? So I'm just really happy that you all are sharing this information, because a lot of people, we need to normalize this.
Yes.
We need to normalize talking about it. We need to normalize seeing it in public, so that we can get the nutrients that our babies and our mothers need. Yes. And so that those mothers, I always hear mothers say, it helped me lose weight. So we need to get that out there.
Yeah, we come into the homes and we provide that education before baby's born, so we can try to get mom introduced to the idea of breastfeeding and any questions or concerns that she may have, before baby's here.
Absolutely.
So as the non-parent in the room, I do want to know what support you provide for families or for the partner that maybe is not the one doing the breastfeeding. Like, what support and education do you provide to make sure everybody's in the loop?
Great question, Will.
So we just kind of provide support for mom, encouragement as well, encouragement. Like I was saying, our program, we try to get into the home every week for the first 6 weeks. So we address any issues that mom is having with breastfeeding. If it's painful, which we do hear sometimes, possibly she's doing it wrong. So we want to correct her and get her to latch baby correctly. Breastfeeding shouldn't hurt. You may have some discomfort initially, for a couple of seconds, but after that, it shouldn't be painful. And then we just want to remind her, to get rest, drink plenty of water, and have that family support. If dad is there or if other family members are there, just to offer that support, because it's crucial in the very beginning.
And to Will's point, what does support look like from the person that's not breastfeeding?
We encourage the dads to participate in our home visits, but also just preparing them for what it looks like in the delivery room. Skin to skin, they can provide that as well. That promotes the bonding experience to dads. And then I like to let them know, mom's going to be tired. There's going to be times where maybe you can do the diaper change, and then she'll put the baby to breast overnight, and take turns. Recognize when she's at her wits and take the baby from her, but those are all ways that they can provide support. I think initially they'll start to feel like, well, I can't really do anything because I don't have anything to give the baby, and then they start to feel a little bit distant. But just encouraging them to just support the mom in any way they can, I think that helps a lot.
I think those are really great tips, because I think, like Will is saying, as a non-parent, sometimes you see a mother with a baby, but you don't know how you could be of assistance or how you can step in and help. So
I think anytime you ask a woman, what can I help you with?
She's going to tell you.
She will tell you.
Well, we are coming to the end of our program. I want to thank you both for being here. But before we close out, if you would each just share a quick story of your favorite moment as part of this program. And Jen, we'll start with you.
Okay. I think my favorite moments are when our patients reach out to us at their most vulnerable times, and we are able to help them get out of that dark hole, and they call and say thank you. I think that is just, I know I am doing what I'm supposed to be doing for my community when I get that sign of gratitude.
That's beautiful. Roxy?
So I would like to say pretty much the same thing, is just hearing that thank you from our clients, coming into them, offering them some support, and, just to see the baby, just to see our client actually. Like sometimes our clients, in the very beginning, they're in school, seeing them graduate, seeing them have their baby, seeing their baby turn 2 years old, just seeing those milestones throughout, and letting them welcome us in to see those milestones.
Awesome. Well, thank you both for the incredible work that you're doing and for sharing this vast information with our audience. How do folks get in touch to take advantage of the program?
They can contact the Southern Nevada Health District. Our team lead is Teresa, and her phone number is 702-759-0779, and ask to speak with Teresa, and she will give you all the information that you need for the Nurse Family Partnership Program.
Perfect. The Healthier Tomorrow program is sponsored by the Office of Chronic Disease Prevention and Health Promotion at the Southern Nevada Health District. August is National Breastfeeding Month, and Black Breastfeeding Week starts on August 25th. Please join us and our partners, Breastfeeding with Maj and Heart and Soul Collective, to celebrate Black Breastfeeding Week at the annual Human Milk Donor Drive on Saturday, August 26th from 10 to 1 at the West Las Vegas WIC Urban League office, located at 6480 West Flamingo Road, Suite B. To learn more about this event or other available resources, please visit our website at www.gethealthyclarkcounty. We've got about 1 minute left, and I want to make sure that we get in some community announcements. So, Elisa, what's going on?
Well, there's always things going on in the community. I would like to shout out Janice Wiggins, who has just started a grant academy. She is one of my savvy women, just a community partner in the community, and she helps nonprofits set up grants, look for grants. She has on her website, she has testimonials of all the different grants that she has helped. As we know, in public health, we are funded by grants. So it's very important to have those people who are knowledgeable and experts in grant writing. So Janice Wiggins, this is your shout out for your new grant academy, and I hope that it's a success.
Awesome. Well, thank you, Elisa. And this has been the A Healthier Tomorrow program. I'm your host, Will Rucker, and I've got my fabulous co-host, Elisa Howard. As I always remind you, you are not just a drop in the ocean. You are the entire ocean in a drop. And what you do matters. So live compassionately. We'll see you again next month.
Thank you.